So let's talk about things that causes too much fluid, right? Too much fluid can be caused by it's not okay, too much fluid can be caused by two things: a lack of the pump of the fluid and a lack of excretion of the fluid. The pump is your heart. So if there's heart failure, we can have what we call congestive heart failure, where we have too much fluid because it's not flowing through the pump. But we can also have kidney disease where we're not expelling the fluid. So those are the two things caused. So what I want you to remember for this, the easiest way to remember the sign and symptom is too much fluid, your patient looks drunk. Your patient looks drunk. Altered level of consciousness, their headaches, seizures, right? That's a drunk person right there. But what else? Fluid tends to exit in the most permeable area. What do I mean by permeable? Easy to pass through areas, the thinnest layers. What are the thinnest layers in your body? Number one, lungs. Pulmonary edema. It tends to exit that way, and you're going to hear what we call crackles. Edema in general, right? The skin. You can have pitting edema. It's trying to exit through the skin. Also, you're going to watch out for what your vitals look like. Blood pressure is a little higher. Also, JVD, that jugular vein distension, because of that excessive fluid. Okay, so whenever you get asked fluid volume, number one, biggest monitoring system is going to be your daily weights, not the I's and O's, the daily weights. Okay, fluid volume deficit. So fluid volume deficit is basically just a loss of that fluid. Dehydration is one, but also when we talk about hypovolemia or hemorrhagic shock, that's when someone's hemorrhaging. They're losing that blood. Okay, so what is that going to look like? Or another one is diabetes insipidus. We're just peeing out that fluid constantly. So those are the things you got to watch out for. So no late signs of this. Early signs is going to be, so the way I want you to remember your vital signs in regards to this is early sign, high heart rate, right? High heart rate is the earliest sign, okay? Blood pressure is usually normal in that early sign. Number two, when we increase in that stage, high heart rate, high blood pressure. The pump is trying to compensate. Both are high. Late, blood pressure drops. And when we say shock, blood pressure is already down, heart rate drops. Okay? So those are how you note down your vitals. Lasix, furosemide, right? So you guys already know what this is for. I think this has been imprinted in your brain since day one, right? It is a diuretic. It makes you pee out. But the thing you pee out as well is your potassium. So 3.5 to 5. Anything with a potassium 3.5 below, you want to hold your Lasix because you will cause a further decrease in that. Okay, G-tube placement. I put your steps down here one by one on how to check your G-tube placement. Of course, then your number one classic gold standard check is going to be your x-ray. When you can see it in the stomach, it's probably in the stomach, right? Glaucoma treatment. So when we talk about glaucoma, there's going to be two forms of glaucoma. There's an open angle and a closed angle glaucoma. Giving you guys a quick breakdown of this, a glaucoma is just an increase of that fluid in the eye right there, right in front of the lens behind the cornea. An increase of fluid buildup, right? There's only so much fluid that can hold. Open angle means there's still some exit for that fluid. Still not as bad. It will be bad, but still not as bad. Closed angle means it's fully closed. There is no exit for that fluid. This is a medical emergency. They need to go to the ED. And most common first-line treatment is eye drops. We have certain eye drops that we give for glaucoma that opens up those vessels. Okay, gout. So gout, right, it's a type of arthritis caused by high uric acids. Your classic symptom is the great big toe swelling right there by the joint. Right, that's the uric crystals developing, the tophi is developing in those areas. So those are things you kind of want to note down. The biggest thing they ask you about gout usually is going to be your dietary, what to avoid. High uric acid food, and these are your top three: organ meats, red meat, seafood. Okay, high purine. Organ meats, red meat, seafood. Now, what do we take for gout? There's two medications we take. We take preventative versus. We take a preventative medication which lowers the uric acid, and we take one for when they're having an acute gout attack. So the two medications you need to note, very, very common, allopurinol, right, lowers the uric acid levels and maintains it. This is what they're taking on a daily. But when they're having an acute gout attack, meaning they're in massive pain, it's happening right now, we're going to take what we call colchicine. Now, we can't take colchicine forever. This is a 1-2 day thing. It has a lot of side effects, okay? All right, Guillain-Barré's, GBS, plan of care, right? What is Guillain-Barré's? That's another neurological condition that's progressive, right? Again, one cause for GBS is, number one, it's an infection. It's something signaling you're autoimmune. It's autoimmune. Whenever we say autoimmune, usually we don't know the cause, right? It's your body attacking itself. Classic signs you have to watch out for your GBS is it progresses pretty fast, 2 to 3 weeks, and it starts from legs upward, okay? So you got to note down the plan of care for this patient that has a progressive weakness from the bottom to top. Number one, legs. They're going to be weak on the legs to start off, so you're going to watch out for safety, ambulation issues, gait abnormalities. So safety becomes your priority. It's going to go up higher to the pelvic area. You're going to watch out for urinary retention or incontinence, bowel retention, incontinence. It's going to go up higher. You're going to watch out for the lungs, right? Pulmonary hygiene, or they need their vaccinations to prevent infections. You're going to watch out when it goes higher. Now you have swallowing issues. So you're going to watch it progress, and you're going to treat it as it should where it's at. Okay, GERD. Nice little way of saying I have chronic heartburn, right? Gastroesophageal reflux disease. So one of the things they're going to be feeling is a lot of heartburn. So what do we teach? Basically, the ultimate treatment for GERD is lifestyle modification. They need to change their habits. They need to change things. Now, what do they change? What causes an increase in acidity in the stomach? Two things: fatty foods and alcohol. So they can't be drinking alcohol anymore, and they have to eat less fatty foods, meaning none of that in and out. They got to eat their chicken salad now. So, they trade up a little bit, lifestyle modification. If they're heavy, obese, they do have to lose weight because that increased pressure of the belly is pushing that up, right? So, and then of course, things to teach them with their meal times. Sit upright after a meal. Don't lay down right away. Whenever you eat a meal, maybe drink your fluids between meals and not during the meal, so that decreases the pressure too. Okay. We already talked about gastrostomy care. Heart failure. So you have your two forms of heart failure, right? Your right side versus left side. Let's just keep it simple. Right side heart failure backs up the fluid into the body, so symptoms are all body. Left side heart failure backs up your symptoms into the lungs, so all your symptoms left side are lungs. Now, specific lab value, BNP, B-type natriuretic peptide. BNP, don't go crazy on it. Just know what it is for your practice. BNP means it's a peptide released by the ventricle whenever there's a ventricular failure. That's the most simplest way we can put it. Now, what do we do with it? Now, if your patient's high, BNP is high, doesn't mean, you have heart failure. No, it's just one of the things we monitor. But just note that BNP is directly correlated to your heart failure patients. All right, HIV/AIDS. Know your CD4 and T cells. Those are the main two types of cells that we watch out for. The lower those get, the higher the progression of the HIV. And it falls below a certain level, which is usually 200. That's full-blown AIDS. So just note those are what cells we watch out for: CD4 cells or T cells. Let's talk herpes. So we have your two types of herpes: herpes 1, herpes 2. Put it in order. Herpes 1 above the waist, herpes 2 below the waist. Herpes 1 is the lips one, and herpes 2 is the genital one. It's ultimately basically number one thing you teach is isolation or precautions. So how does it spread? Number one thing you teach them is when the vesicles or blisters are open, they're highly, highly infectious. Okay, there is no cure for them. There's just remissions for the outbreaks, and we give medication to decrease the risk of transmission. All right, we talked about hyperglycemia. We talked about hyperkalemia, hypocalcemia. Okay, we talk hypocalcemia. So let's talk just low calcium in the blood in general. What is calcium for, right? Calcium's for bone. That's the number one way you know that. But also, calcium is for your muscles as well, for impulse and neurotransmission, for electrolyte transmission, right? So the number one thing you're gonna note down is know your basketball player, right? They drink Gatorade all the time because they replenish their electrolytes. So low electrolytes, what do? They cramp up or muscle spasm. Those are the things you're gonna watch out for with low calcium: muscle cramping, muscle spasming, tremors. The biggest term for that is called tetany. That is the muscle spasms. Multiple different types of spasms. The two classic ones you need to know: Chvostek's is the cheek. When you tap on the cheek, they spasm. And then Trousseau's, when you put the blood pressure cuff, they tend to do gang signs because they're spasming on the hand, right? But ultimately, stridor, that is muscle spasming of the throat. When they're spasming of the throat, the stridor is the sound they make. Remember that crowing sound, that dying seal sound, that dying whale sound? That's what's happening there with stridor. Okay, let's hypoglycemia. So we talked about a little bit about your DKA, but when it comes to hypoglycemia, you remember your 15-15-15 rule, right? So you want 15 grams of fast-acting sugar and recheck blood sugar within 15 minutes, right? And give another 15 grams. So usually that's going to be your juice, 4-ounce orange juice, check blood sugar again in 15 minutes, and give another one. And then long-acting protein, so like a peanut butter sandwich. Hypovolemia, ruptured spleen. So spleen, you got to know the purpose of your spleen here. When we talk about your spleen, it is where blood goes to be recycled, or it's basically waste management of blood. It recycles old blood, So if your spleen is ruptured, usually in a motor vehicle accident, right, we can have severe hemorrhagic or hypovolemia events. Toradol is an NSAID. Just remember that for your Toradol, it is usually only given IM or IV. So just note the signs of what an NSAID does, all right? And one of the biggest side effects that you watch out for is the GI bleed. Also, NSAIDs, know which is toxic to liver, kidney. Kidney, right? It's toxic to kidney. Intracranial pressure. So we haven't lectured on the ICP just yet, but let me give you a quick breakdown. You have your skull. Your skull has 3 things in it, and we'll talk about this in depth a lot more in later topics. But let's talk about your skull. It has 3 things: brain, blood, cerebrospinal fluid. Okay, 3 components. Only 3 components. Your skull does not expand. Your skull does not contract. It stays the same. Meaning those 3 components have to be in complete balance. If there is an excess in brain tissue, the other 2 decreases or pressure increases. Increase in blood or increase in CSF, lot more pressure. Good. Now that you know those signs, you have to know what signs and symptoms occur when there is an increase, right? Number 1 neurological symptom for any neural changes, it's a altered level of consciousness. Those are what you're going to watch out for, those alterations, right? Now, in increased intracranial pressure, our body tends to do certain things to compensate. It wants to lower down the pressure. So what does it do? You vomit. Vomiting is one sign that occurs. Okay? Headache, vision changes, perla changes. Those are all in the head. Watch out for all those. Now, you have your skull, you have your brainstem. We told you that the brainstem was in control of your vital signs. If that pressure increases too much, that it pushes on the vital sign center, you're going to look for vital sign changes. And that is an emergency. That is usually a sign that someone is going to have brain damage or brain death. What is that called? Cushing's triad is what it's called, right up here. Cushing's triad, you're going to watch out for 3 things: low heart rate, regular respirations, and widening pulse pressure, meaning their systolic is getting higher, diastolic getting lower. So if you're 120/80, it becomes 140/60, 150/50, right? It's getting wider. That's a very ominous or dangerous sign. Incontinence, main thing you got to watch out for is skin. So make sure you're providing skincare. Kaposi sarcoma, whenever you hear the word oma, think cancer cells. So it's a type of cancer that develops on your lymph and blood vessels, usually with your herpes patient or your chemo or HIV patients. Just note those are what you're noting down for. Those are skin lesions. They look like skin lesions like that. Leukemia.